be 4 integrated
Yes,
multidisciplinary teams, and the reason we're looking at 4 is because out of the primary care strategy there's going to be 4 clusters of GPs, and so what we want to do is to build around that so that the GP will actually know the teams that they have working with them and will be able to work across the piece now. Again, I'm hoping that what that does is significantly improve the working relationship with the primary care out in the community. And what we're doing, often where they're in specialist teams, but actually what we need is those specialist roles to be working as a part of a much more holistic service.
Chris, where will those teams be based?
Well, I'm assuming Needle House.
Right.
But what we've done is by bringing in now a whole cluster of individuals. And what's interesting is, sorry, the other bit about flexible and remote working is that the Eagle House is completely open plan. So even for us as a senior management team, we all operate in a completely open plan environment. And I don't think that's me. It's not part of the presentation.
Everybody take his pills.
I've taken them. I thought I'd turn the fan on.
That's all right. The other bit that's important is that it's all hot desking.
Yeah.
But what that means is you can actually have a much higher number of staff in an environment when you're not actually giving people their own desk, their own office. So we have something like, at the moment, about 120 staff operating from about 65 desks. Now, it is never full, because I said at the beginning, all of our work's out there in the community. It's in your homes where we're doing our main work. And there are other bits as well, which is the flexible and remote working gives you much greater capacity. It doesn't mean you've got to come back to the office to complete your assessment, to complete your paperwork. Actually, you can do it in a person's home. You can actually sit in your car and do it. You could actually sit in a cafe and do it. Now, my managers were a little bit perturbed when I used to say this, because and bear with me, and I don't want this going on a blog, but I'm saying to people, if you've got an appointment at 9 o'clock in the morning or 9:30 in the morning, why are you coming in the office first to go back out to an appointment? Because you've now got the tools that actually you could sit at home for half an hour and actually do some reports, do your emails, whatever. And we have an auditable trail because the system tells us what people are doing. And actually in there, what was interesting was when we started was, from the management point of view, there's a concept that says you're working because you're sat at your desk. Actually, our productivity has definitely gone up. We are definitely improving productivity as a consequence to the ways that we're now working. But it's about empowering individuals and trust from that. I went to visit a mental health trust in the UK several years ago, and there was a chap called Patrick Gabriel, who was the Chief Executive Officer. And at that time I was a bit resistant to this. And I said to him, and they had fantastic examples of what we've introduced now. And I said to him, how do you know? How do you know people are doing the job? And he looked at me and he said to me, he said, you know, we work with some of the most vulnerable people in our communities. He said, I think if we can trust them with their lives, I think we can trust them with their time. And actually, that completely changed my approach, and I can honestly say, and Steve, who's one of my senior managers who works with me, is here tonight, and we've definitely seen a real improvement in productivity and a real improvement in, if I say commitment, I'll give you another example, and in particular for parents with children. Historically, if somebody's child's poorly, often that might end up with a member of staff taking the day off because they can't get alternative arrangements. Actually, what happens now is somebody might do a couple of hours at home, they sort something out, and then they come in. And actually, it just improves that whole productivity across the piece.
Thanks, guys. Yeah, cheers.
I think that is an area we need to get smarter with.
Yeah.
which is about right at the beginning, sharing the right information with carers. And actually, I don't think we've been anywhere near good enough for that before. It doesn't mean to say we don't get it right, because I think we do. I think there are lots of examples where we get it right. I think there are too many examples where we haven't got it right, because we often focus on the individual, and we have tended to think in this context of confidentiality and the ability and the consent issues of sharing, when actually it's really important that we understand what we're sharing from a carer's perspective, because you know, your needs as a carer is as important and often different. So I think it's something we're aware of and we're looking to continually improve right at that first point of engagement about how we have those open conversations with anyone who's associated with the individual who would be deemed as primary care.
Chris, could you just give us a little steer? I mean, lots of carers are youngsters, children. How do you deal with that sort of situation?
Yeah, we have to work in partnership with the Children's Service on this as well. And actually, it's really the same issue here, is that it's how we join up the bit about it not having several front doors, one contact, who is the best person to be able to facilitate that discussion with a young person. And often that's about engaging with education, because often education are in the best place from a relationship point of view to be able to have that open conversation, but then allows other people to come in. And it's very complicated sometimes, because we have the issues of the adults themselves in need, their consent to act, and then we have the children being able and willing to open up and disclose some of the pressures that they're under. But again, it's something that we're very aware of today, much more aware of, and actually we do work in very close partnership with our colleagues in children's and education.
Can I ask something? Is it possible to use SPOR to do a referral for independent advocacy, and how integrated is independent advocacy into this hub, bearing in mind that they have to be independent and represent the client?
But the answer to can you use it to almost spearhead the assessment is yes, because right at that front door should be the right information to steer somebody to where they want to go. Now, independent advocacy doesn't sit within my service areas, but there are clearly areas of independent advocacy out there. So I would expect that if somebody contacts us, we would be giving the right information and the contact points, and offering the support that says, you know, do you want us to contact them and give them your details? But we wouldn't then be involved, because otherwise it's not independent.
No.
Well, I was going to also follow on from that.
It's the standard.
I'm not saying anything.
When a referral comes into the SPOR, I expect that that referral is responded to you as the referrer within 4 working hours. Okay? So we will know within 4 working hours if it needs to come inside. When it comes inside, I'm expecting that within 24 hours it's allocated to a worker. When it's allocated to a worker, I'm expecting the assessment is completed within 21 working days. Those are the standards that we've introduced for this year. I did introduce them last year, which is why I was a little bit cautious. But actually that's clearly the expectation for us. Now, in some cases, an assessment might take longer than the 21 working days. But on those cases, I want to understand why. There has to be a reason as to why it might take longer. And often when, you know, if an individual's got very complex needs, that might mean engaging with a whole range of professionals to bring all of their assessments together. But actually, our target is within 21 days.
And is there a way of, if it is urgent, kind of like something
Yeah.
to be done now, is there a way of tagging it so that
Yes.
you guys are aware something
Yes.
needs to be done now
Yeah.
rather than...
We prioritise at that front door. If it's a high priority, it would get a much more urgent response. And in particular with our mental health services, we will not be changing the liaison response. because our liaison response here in Jersey is excellent compared to a lot of authorities in the UK. Now, geography plays a big part because we're only 9 by 5. But what we know is, I hope James will back me up on this, I mean, we have an average of 20 minutes as a response for somebody in crisis with mental health, which is, and we are accredited by the Royal College of Psychiatry as an excellent service. So, you know, when we come to tinker about and change and reshape things, there are some things we don't want to change, but that is an excellent response as a service.
Okay, is there anything?
There will be 4 integrated multidisciplinary teams, and the reason we're looking at 4 is because out of the primary care strategy, there's going to be 4 clusters of GPs. And so what we want to do is to build around that, so that the GP will actually know the teams that they have working with them, and will be able to work across the piece now. Again, I'm hoping that what that does is significantly improve the working relationship with the primary care out in the community. And what we're doing, often where they're in specialist teams, but actually what we need is those specialist roles to be working as a part of a much more holistic service.
Chris, where will those teams be based?
Well, I'm assuming Legal House.
Right.
But what we've done is by bringing in now a whole cluster of individuals. And what's interesting is, the other bit about flexible and remote working is that the Eagle House is completely open plan. So even for us as a senior management team, we all operate in a completely open plan environment. And I don't think that's me. It's not part of the presentation.
Ever to take his pills.
I've taken them. I thought I'd tell the farmer.
That's all right. The other bit that's important is that it's all hot desking.
Yeah.
But what that means is you can actually have a much higher number of staff in an environment when you're not actually giving people their own desk, their own office. So we have something like, at the moment, I think about 120 staff operating from about 65 desks. Now, it is never full, because I said at the beginning, all of our work's out there in the community. It's in your homes where we're doing our main work. And there are other bits as well, which is the flexible and remote working gives you much greater capacity. It doesn't mean you've got to come back to the office to complete your assessment, to complete your paperwork. Actually, you can do it in a person's home. You can actually sit in your car and do it. You could actually sit in a cafe and do it. Now, my managers were a little bit perturbed when I used to say this, because